Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Hey, Veterans Health System surpasses 400,000. That's a big number. So I wanted to talk to you about that and share that information with you. Just good to have just an overall awareness on what's going on, right? We can't walk through this world blind, especially when it has to do with the services and the agencies in which we get services from, right? So as a disabled veteran, it's important to kind of just know what's happening. One, because you can leverage that information. You can share it with others. You can have a conversation with your congressional leadership and so forth, and actually have some sort of awareness. So my goal here is to share the highlights of things, and if you want to dig deeper, obviously we can always dig deeper. But let's jump into it. Hit the thumbs up for me, subscribe, share with a friend, all that good stuff. I appreciate it. If you're not a member, consider joining. It helps the channel, and that little icon next to your name helps me find you in the comments, which is always helpful. All right, let's jump into it. The headline here is Veterans Health System surpasses 400,000 employees as record hiring continues. The Veterans Health Administration, this is an article that I found on military.com. The Veterans Health Administration has added nearly 49,000 new employees this fiscal year as demand spikes amid an avalanche, because I can't say the word, of claims and new enrollment from the PACT Act. It is closing in on a total goal of 52,000 hires by September 30th. The majority are in occupations under that Undersecretary of Health, Dr. Sharif, calls the Big Seven. Jobs that directly affect patient care and services, including physicians, nurses, licensed practical nurses, nursing assistants, medical support, food service workers, and housekeepers. Let's see, story continues. Bam. During a roundtable with reporters Tuesday, the Undersecretary for Health said that the VHA, Veterans Health Administration, has hired 27,296 employees in those positions with an end goal of 30,000, part of the 52,000 amount for the fiscal year. I'm really proud of all the network leaders and medical center directors for executing on this. And we're working as hard as we can to not only try to bring more folks on board, but improve the hiring process itself, he said during the roundtable. The VA embarked on a hiring spree last year to accommodate increased demand related to the PACT Act, which expanded benefits and health care services to combat veterans across several generations. A PACT Act provision gave veterans who had never enrolled in VA health care, served in theater of operations after November 11th, 1988, and were discharged or released between September 11th, 2001 and October 1st, 2013, a special one-year window to enroll in VA healthcare. As a result, 113,719 additional veterans have signed up, with more expected by the deadline of September 30th. To ensure that VA hospitals and clinics can handle the influx of new patients, it aimed to hire 52,000 new employees during the fiscal year of 2023, the highest growth for the administration in 20 years. The VA healthcare system provided more than 91 million outpatient appointments to 9 million veterans enrolled in VA healthcare last year, according to the agency. While many of the new employees will provide care and services within the VA medical centers and clinics, some of the Big Seven employees, medical support assistants, have been hired to support the department's community care program, which allows veterans to receive care from non-VA providers when treatment is not available at VA facility or wait times for appointments are too long. The Undersecretary said that the VHA, Veterans Healthcare Administration, the part of the VA that runs its nationwide network of healthcare facilities, is ahead of schedule for hiring those personnel who oversee schedules and coordinate appointments and services within the community care network, although he did not provide exact numbers. Despite the successful hiring effort, the administration is struggling to hire nursing assistants, licensed practical nurses, and housekeeping aides The undersecretary said the department is using allowances under the PACT Act to provide recruitment and retention and critical skills incentives to be more competitive, but remain overall short of their goals in those areas, he added. The VA also continued to wrestle with the length of time it takes to hire employees. A government job, anything on that will take forever. Hiring employees and prepare them for work, the onboarding process that entails paperwork, background checks, and other human resources requirements before the person can start work. In June, the median onboarding time was 160 days, according to the VA. That's way too long. That's obviously way too long, he said. He added that the department has taken on measures such as implementing USA staffing and the U.S. Office of Personnel Management talent acquisition system to monitor hiring packages and streamline its hiring process to help reduce the wait. In January, the Government Accountability Office found that the regional and medical VA facility staff did not always input complete data in the USA staffing system, leaving questions of whether the VA was onboarding new employees at its highest efficiency. The GAO recommended that all offices comply with the requirements of the USA staffing system and ensure that employees received guidance on its use. The VA concurred with the recommendations and has started to implement them. That concludes the article here on military.com. And again, this just came out on August 15th, and just wanted to share it with you so you're aware of what's going on. A lot of staffing stuff, but there's still some issues with staffing in some of those critical areas like the nursing and so forth. I know regionally, I had run into some of those issues at the VA medical centers and clinics, and it really was an issue with cost of living. So in higher cost of living areas, even though the GS scales will have adjustments based on geography, sometimes it's just not enough for it to make sense when you could, as a medical provider, work across the street at another medical facility and make 25% more. You really would have to honestly have a soft spot in your heart to help veterans in order to take the pay cut and go work for the VA. Even the retirement system isn't as good as it could be, as they used to be, I guess. Even compared to some of the more localized governments, like say a county government or a state government would have sometimes there'll be county hospitals and so forth where these people can work and get a better retirement. So with that, we'll go ahead and end it there. Just wanted to keep you in the know, and remember, if we don't take care of each other, something went wrong. Have a great one.